Kogi State on Wednesday kicked off COVID-19 vaccination a day after receiving 16,900 doses of the AstraZeneca vaccine from the federal government. The state becomes last in Nigeria to receive the vaccine owing to the stance of the state government on the infection. The State Commissioner for Health, Saka Audu, flagged off the vaccination exercise in Lokoja, that's the Kogi State capital. The Executive Director of State Primary Healthcare Development Agency, Abubakar Yakubu, was the first person to get vaccinated, followed by Usman Zakari, Chief Medical Director of Kogi Hospital Management Board, and other frontline health workers. Authorities have asked residents of the state to take the vaccine, saying that nobody will be deprived of it or forced to receive it. And Dr. Japhet Olubogi, a public health physician, joins me now to discuss more on the latest NCDC figures. Good to have you join us, Dr. Japhet Olubogi. Now, what a lot of people, we haven't recorded deaths in the past 6 days, and people have now attributed the latest figures to the fact that, look, we have started vaccinating people in the country. Do you think that that's the right assessment of the current situation?
Yeah, I think it may not be all connected to the fact that people have started being vaccinated in the country. The people who are being vaccinated right now are frontliners, health workers, the military, and all that. These are the people who easily, naturally will have spread the virus to other people. So when they are vaccinated and they are protected from spreading the virus, so the number of cases can actually reduce after vaccinating them. So it may not be all connected to the fact that this set of people are being vaccinated right now.
But that's for number of cases. You just mentioned that the number of cases would reduce. But would it also have impact on the number of deaths? Because we're seeing now that we haven't recorded deaths in past 6 days, and then we're also seeing that the number of people who have been discharged is getting closer to the number of cases that we have recorded in the country.
Yes, sure. Let's not forget that apart from the frontliners that are being vaccinated, we also have people who attend orders or strategic leaders who are also being vaccinated. And one of the things that the vaccine does is to prevent serious illness and to prevent death in people. That's why we keep saying the benefits of taking this vaccine outweighs any risk that anybody can attribute to it. So when people take this vaccine, even if they develop, they have the virus, it will ultimately prevent them from having a serious disease or even dying from the disease. So yes, it is one of the attributes of the vaccine. Not dying or not recording any death is one of the positive sides of the vaccine, of taking the vaccine.
So we have recorded about 163,440 cases, and we have discharged about 153,788 cases, which means that the active cases we have at this moment is roughly just above 9,000. Does that mean that at some point we're going to have a situation where, the number of discharged people and number of confirmed cases will be the same, and then we can say that we have dealt or curbed the spread of the virus in the country?
That is the ultimate goal at the end of the day, and that's why we encourage everybody who has access to the vaccine, who should take the vaccine, as to when they should take the vaccine, to go ahead and take the vaccine, so that at the end of the day, we wouldn't have to chase people to wear their masks, we wouldn't have to chase people or prevent gathering and all that. So ultimately, we want a situation whereby we achieve what we call herd immunity. At least when the number of people who are taking the vaccine is high enough to protect everybody in the community, everybody in the country, everybody in the society from coming down with a serious illness from the virus. So that is the ultimate goal. Actually.
And hopefully we get there really soon. Dr. Japhet Olubogi, yes, public health physician. Thanks for talking to us.
Thank you for having me.